All right, we are just a little bit after 10, so I'm going to go ahead and get started. I believe all of my co-panelists are on. My name is Molly Manette. I am the Admissions and Recruitment Specialist for the College of Nursing at Michigan State. I'm going to let my other co-panelists introduce themselves, and then we'll go ahead and get started.
Good morning. I'm Dr. Kara Schrader, and I am a family nurse practitioner and director of the primary care nurse practitioner program, which includes the family nurse practitioners and the adult gerontology nurse practitioners. I absolutely love being a nurse practitioner, and I hope that you will learn about the program and enjoy it as well.
Good morning, I'm Dr. Dawn Goldstein. I am the program director for the Psychiatric Mental Health Nurse Practitioner Program. The program started in the fall of 2019, and we have been getting a good amount of students registering and applying every year, and it's exciting to see we've had one cohort finish and continue to run now 2 groups simultaneously, so it's really becoming something that we're seeing a lot of interest in, and students live all over the state of Michigan, and we try our best to put students in places where they might be in, living in their communities. So we're excited about this webinar today. Thank you, Molly, for inviting us.
Good morning, I'm Jessica Kinnear, and I am the academic advisor for all of the graduate students in the College of Nursing.
So you're joining us this morning because you are interested in the nurse practitioner program. So we thank you for taking some time out of your morning to meet with us. I am going to allow time for questions at the end of the presentation here. The 3 of us will speak, and then I'll open it up for questions. If you have any questions as we go through, please feel free to put those into the chat box or the Q&A box. Both of those are open, and we will be watching for questions as we go. So any questions that you have, certainly get those into the box there, and we'll get them answered for you. As you can see here, the nurse practitioner program at Michigan State, it trains nurses in both acute and primary settings, depending on your area of interest, your concentration. We are training our students to work with a variety of different patient types, different populations, as well as being trained to work amongst other healthcare professionals. So our graduates are eligible to sit for certification in their population area after they graduate. And we do have 3 different concentrations with the nurse practitioner program. And I'll actually turn it over to Dr. Schrader, to Dr. Goldstein to talk about their individual concentrations. So Dr. Goldstein, if you'd like to start us off.
Yes, just so that you have a bit of an understanding, the psychiatric mental health nurse practitioner concentration really prepares nurses with knowledge, the skills and areas of mental health promotion, mental illness, as well as substance use disorders, honing really thorough assessment skills as it relates to psychiatric mental health, and diagnosing and evidence-based treatments, whether it's pharmacotherapy or psychotherapy, and also patient education. And we care for individuals across the lifespan and in all settings. So it can be an acute care setting, it could be more of a clinical liaison in a hospital system, or outpatient setting.
Thank you, Dawn. So the primary care nurse practitioner program has 2 different concentrations. The adult gerontology primary care nurse practitioner, and up in the upper right corner is a grad of ours. That's Dr. Patrick Hawkins. He's an adult nurse practitioner. We also have the family nurse practitioner program. So the adult gerontology primary care nurse practitioner can see patients age ranges age 13 until the older adult end of life. The focus of this program is our vulnerable or frail elders, but they can see patients across adolescents, across to the frail adult. Now the primary locations of clinical placements for and places of employment for these nurse practitioners can be long-term care. We have a lot of graduates also in the VA settings. And also internal medicine is another type of clinic that this type of nurse practitioner would be qualified to care for patients. And adolescent care. There are adolescent clinics across the state. The family nurse practitioner can see patients from the prenatal time until the end of life. The focus for the family nurse practitioner program are family clinics, as well as clinics that are in low-income areas, the areas of the greatest need. Both of these programs have that focus as well. We provide a range of primary care type of clinics. And if you have any more questions about what they do, we will put our emails in the chat.
Thank you, Karen. So MSU's Nurse Practitioner program, it is a hybrid program. However, the majority of your coursework is going to be offered online, and Dr. Schrader and Dr. Goldstein will talk about that, those courses momentarily. If you are a primary care nurse practitioner, the adult gerontology and the family nurse practitioner, you will be on campus a couple of times a semester. The psych mental health students are primarily all online. One of the things that makes Michigan State unique is we have a clinical coordinator, and this is an individual who is dedicated to helping you find your clinical placements. So that's one thing that kind of sets us apart, that we are proud to offer our students, is that they don't have to seek out clinical placements on their own. We do have an individual here in the college whose primary function is to help you find those placements. So we will be placing you in your clinical settings. And as Dr. Schrader said, we place students in a variety of different settings all across the state. So we have quite a variety of options for students when seeking out clinical experiences. There are 4 pathways to earning your degree as a nurse practitioner here at Michigan State. We do offer the MSN degree. We offer the DNP degree. If you are looking to go straight from your bachelor's to earning that terminal DNP degree, we offer that. We also offer a postmaster's DNP. So if you have already earned your master's degree and are looking to complete that terminal degree, we do offer a route for that. As well, we offer a postgraduate certificate. So this is meant for students who are looking to expand their scope of knowledge. We do offer a 5-credit postgraduate certificate in each of our concentrations as well. So the MSN degree, that is 54 credit hours total. So this would be, again, from the BSN to the MSN, you're looking at 54 credit hours. You're welcome to do this program at both a full-time or a part-time pace. And for all of our programs, again, we do try to be as flexible for you as possible. So you're welcome to switch between full-time and part-time should you start off as one. Let's say you start off at full-time and you realize it works a little bit better with your schedule to go at a part-time pace. We do offer the ability for you to switch back and forth between the two. The DNP, if you are looking at the BSN to the DNP route, that is 70 credit hours total, again, full-time or part-time. Our DNP students are working on a scholarly project. And again, Dr. Schrader and Dr. Goldstein will explain a little bit more in depth on that momentarily. Our DNP students have a focus on evidence-based practice and leadership. So that is a big part of the DNP curriculum, and seamless pathway from the BSN to the DNP. So again, we try to make that degree as accessible for you as possible. The postmaster's DNP, as I mentioned, this is meant for students who have earned their MSN and are looking to earn that terminal DNP degree. We recognize that every student comes from a unique degree pathway. So we do complete a review of your transcript. We look to determine what the gaps are between your MSN curriculum and what you are looking for in that DNP. So you will have your transcripts evaluated by our faculty to determine your pathway to the DNP. Again, you are completing a DNP scholarly project and you're welcome to move at a full-time or a part-time pace. The graduate certificates, those are meant for MSN or DNP prepared APRNs who are, again, looking to expand their scope of knowledge, learn a little bit more in one of the concentrations so that they're able to provide even better care to their patients. The postgraduate certificates, those are 5 courses total for a total of 27 credit hours. So I will turn it back over to Dr. Schrader and Dr. Goldstein and let them explain a little bit more about the core curriculum as well as the individual concentration curriculum courses as well. So Dr. Schrader, I think I'll pass it over to you.
Okay. Okay, these courses, as Molly mentioned, are considered core courses. These are the fundamental courses that you will need before you get into clinical practice. And I'll just go over briefly a few of those. Nursing 902 is Scientific Foundations in Advanced Practice Nursing. All of the concentrations, including our CNS and our nurse anesthetist program, take this course. It is really the evidence-based practice course in our program. It gives you the fundamentals, as I said before, to apply evidence-based practice into your clinical settings and your professional life. Healthcare informatics, I'm not sure I need to explain that because it's self-explanatory, but it's looking at informatics and how you can utilize informatics within your professional career. And this is, it's a well-rounded course, and it goes across all concentrations, but when you get into the concentration-specific courses, you'll really need informatics and know how to assess informatics in order to provide care. Clinical epidemiology, this is a course that's taught actually through the College of Epidemiology. And this course looks at population health and how it relates to care across the lifespan. Again, all of our APRN programs, concentrations take this course. Health policy and advocacy. This course looks at health policy generalized as well as focused on nursing, specifically advanced practice nursing. The quality and safety course, which is Nursing 905, looks at ways that we can improve health as an advanced practice nurse in working in our clinical settings to improve health. This really is quite the core of nursing and what we can offer as registered nurses. It's really where we shine in addition to our concentration specific training. And of course, leadership is another way that we shine, and it is the core of being an advanced practice nurse, as specifically being a leader as a doctorally prepared advanced practice nurse within health systems. Pathophysiology, physical assessment, and pharmacology we refer to as the 3 Ps. Pathophysiology is an online class, as all the other ones I just mentioned. Then pathophysiology is an online class. It looks at pathophysiology, meaning disease, at an advanced practice level. It's that one level up from your bachelor's level. It's a fast-paced course, but quite fascinating, and it's a very interesting course. I love patho. It's another fundamental. And you really need pathophysiology before you go into physical assessment, which is the next course. Physical assessment is across the lifespan. It is for all the advanced practice nurses. The nurse practitioners do come to campus and once a month, and go to our Learning Assessment Center to practice skills. We have a really amazing Learning Assessment Center where we hire standardized patients to help in the learning process. Advanced pharmacology, again, is really what it says. It's advanced pharmacology from the advanced practice level. Again, another step up from your bachelor's education. Now we get into the Doctor of Nursing Practice Project, which is a series within 3 semesters. These are projects that are developed with community partners. It could be a clinic that you already are in. If you are already a postmaster's student and have a clinic, then you most likely will do your project within your clinical setting, but you don't have to. The faculty work with community partners. We also call them liaisons to help get your project off the ground. And it's really a series of 3 courses where the first one is just working with your liaison, finding out what the organization needs and developing a project proposal. The next course is that implementation of that proposal. And then the last course is dissemination. It's looking at, it's doing a data analysis and then disseminating to your organizations as well as your classmates and the college. Do you want to do yours, Dr. Goldstein, first? And I'll take a drink of water.
Sure. So when we look at the concentration courses specific for the psychiatric mental health nurse practitioner, the first course is offered in the summer, and that's Nursing 952. That's the psychopharmacology and neuropathological basis of mental illness. And that really puts an emphasis on the neurobiology of what is happening in not only just our normal brain structure, what to expect in certain structures, circuitry, neurotransmitters, but then as we bridge in the psychopharmacology, it helps us identify what medications target what receptors. So it gives a good basic foundation before we dive in further in the fall to Nursing 953 with the clinical diagnosis and management 1, where the emphasis really is on the psychiatric assessment and diagnosis. This is where students will also begin their clinical hours. So for this first diagnosis and management course, there's 135 clinical hours that are attached. And again, the emphasis on just the broader sort of mental illnesses that we're most familiar with, and looking at thorough assessments and being able to at least come up with some differential working diagnoses and what might be a primary diagnosis. We begin that process of treatment, but especially with psychopharmacology. But once we get into Nursing 954, clinical diagnosis and management 2, we get into more evidence-based therapeutic interventions, primarily psychotherapy. So we continue with the psychopharmacology, but also psychotherapy, and not just the breadth, but the depth of specific psychotherapy modalities like cognitive behavioral therapy. Everyone will have gotten a good baseline of motivational interviewing in that first clinical diagnosis and management course, but we dive much deeper into cognitive behavioral therapy and a few other psychotherapy modalities. When we hit Nursing 955, we're doing more special populations, and it might be a deeper dive with children and adolescents, even though we have already covered everything is threaded through. So when we look at a particular disorder, we're not just looking at what does this look like for one population. We're looking at how does it relate to somebody who might be a child or an adolescent or an older adult. When we get to Nursing 955, we dig deeper into the child adolescent, the older frail adult, as well as our veteran population, as well as our LGBTQ+ population. So any additional specialty population, we spend more time. And again, we're still looking at 135 clinical hours per semester. It isn't until we get to Nursing 956, more of a complex, collaborative, integrated mental health care, that we get into 180 clinical hours. And this is, again, more complex. What do you do with somebody who's treatment-resistant depression? What do we do when we have a patient where we're seeing a lot of polypharmacy or they're on several antipsychotics? How do we now start altering or revising someone's treatment plan? As you can see, the 953 through 956, they're part of that diagnosis and management or a clinical management. They also have simulation that is every semester. So in the spring, there's 3 simulations. In the fall, there's 3, and in the summer, there's 2. And all of our simulations with standardized patients are done virtually, so that students will get very adapted to telehealth. since that is another area that you may find as an option for employment. Even when we get into 956, when you have 180 hours, we'll still be doing simulations. And we have 2 interprofessional simulations twice a year as well. The final, clinical management, is more of an immersion. So if you're on that BSN to DNP track and you've really found that you feel children and adolescents is your niche, or maybe you want to spend more time with substance use disorders and that medication for addiction treatment, whatever you want to specialize more in or spend more time in, we will find you those clinical placements that give you more of those immersion hours. And again, that's 180. All of these courses that you see are online. As far as the synchronous and asynchronous, or the didactic piece, as well as including Zoom sessions. So we meet on a regular basis for each of the courses, but you're not having to come to the campus for any of those courses. You will be, more than likely, in different clinical settings, and that we do provide that nation and finding you clinical placements close to where, as best as possible, where you live. And they will be in various settings. So many outpatient, inpatient, maybe as a clinical liaison going around the hospital doing psych evals. It could be in the emergency room or even in urgent care.
Okay, so I'm going to talk about both of these primary care programs and just specify the difference within the courses. Both programs are primary care. The first course is 912 for the family and 913 for the adult. And this is an online class, but it focuses on health promotion from a population viewpoint. We then go into a regional and local type of populations, and then to the clinical population as a primary care nurse practitioner. Now we focus on the evidence behind screenings, and that which would be primary, secondary screenings. We look at the evidence behind certain primary care types of settings. The adult gerontology students will look at specific settings in like long-term care and the PACE centers. And then the family nurse practitioners will look at primary care settings, such as family nurse practitioner or the family settings, urgent care, and some other transition of care type of settings. The next course, which is the first clinical diagnosis and management course. It is a clinical course with 135 hours. The focus as the first clinical course is on acute care kind of conditions, outpatient acute care. So this would be urgent care. It also could be a primary care setting for which students would focus on minor acute conditions. So minor acute conditions would be like a sinusitis, an ear infection, pneumonia. It could be gastrointestinal, COVID. It could be a variety of things that we can manage as primary care nurse practitioners in an outpatient setting. We work intercollaboratively, of course, with other professions, but this is what we focus on in primary care. The next course is focused more on the vulnerable adult for adult gerontology and the family nurse practitioner. This is when the placement in OB clinics would occur to care for the prenatal patient, the postnatal patient, and women's health. The adult gerontology would be long-term care, internal medicine. It could even women's health, not the prenatal part of that, but women's health in general. Then the next course is another clinical course, 135 hours. This is a focus on chronic disease, such as COPD, diabetes, hypertension. We also do many modules on mental health and from the primary care perspective. It's a fast-moving course like all of them, but this one integrates everything that you've learned from the acute care, from well child visits to chronic illnesses across a lifespan for family, and then of course from 13 to end of life for the adult gerontology. The last course for the master's students is 928 and 918. This is more hours than the other courses. This is 180 hours. It's pretty much all in the clinical setting with a focus of the most complex patients with chronic conditions, multiple chronic conditions. We also get into professional issues when it comes to primary care and the nurse practitioner and the role within primary care and health systems. And then 929 is for the doctoral students. This is the final of their clinical courses with an emphasis, of course, of clinical. It's 180 hours plus some interprofessional experiences. You also can specialize possibly in another urgent care rotation, maybe going back to pediatrics. It could be working in a pulmonary clinic that sees across the lifespan, and then just adults, adolescents and adults. We also can look at dermatology placements for you. It's really what you desire to do. All those skills can be utilized in primary care, and really the focus is to see back-to-back chronic illness in these specialty clinics so you can be better prepared in a primary care setting. Now, 925 or 915, the first clinical course all the way to end, they do meet on campus. It's more common or more frequent to meet on campus the first clinical course, but as you go through the clinical courses, more and more is online with the focus of just being in clinical. We find the placements for you, as Dr. Goldstein mentioned, and work with you on clinics that you may have interest in as you go further down into clinical diagnosis and management courses. The final 3 courses pretty much are all in line with synchronous course, which is courses that are at the same time, of course, synchronous and working with your faculty. All of the clinical faculty and faculty that are in the program are required to practice. So we do keep current, up to date, and often students are placed within our clinics.
So you're interested in the program and you're looking forward to submitting your application. A couple of key things to know about the application. We are accepting applications now. Our application cycle generally runs from September to April 1st. For the MSN and the DNP program. So again, those applications are live. They are available on our website. Deadlines for those programs are April 1st. So you have between now and April 1st to submit an application, and I'll go over what's required of a completed application momentarily. But again, April 1st is the key deadline to mark in your calendars. For the certificate programs, those deadlines do vary. The family nurse practitioner and the adult gerontology nurse practitioner concentrations, those begin in the spring. So those applications are due to us by October 1st each year. The psych mental health certificate program that begins in the summer. So applications are open for that program until March 1st. So you want to make a note of those key deadlines. We do aim to admit about 50 to 60 students every year, but that is not exhaustive. We do admit more students than that each year, fewer students. So 50 to 60 is our key range. But again, that does vary. So a completed application consists of all of the following here as outlined on this page. Within the application, you are asked to upload your curriculum vitae or your resume. So this gives us a good sense of what your work experience is like, what types of placements you've had, what kinds of work experiences you have had. It gives us a sense of your education as well as any extracurricular or activities that you do that you feel would be important for us to know. So that is a required piece of the application, as is your personal statement. Now, the personal statement, this is your opportunity to share with the admissions committee what your motivations are for pursuing graduate study. So of course, we're looking at your transcripts, but we're also looking to get a sense of why you're interested in the program that you are. So this is a chance for you to share that story with us. We do not have a set word limit or page limit for the personal statement. Again, please feel free to use the space that you feel is necessary to share those goals and that story with us. You are also required to, of course, have an unrestricted license to practice as a registered nurse in your home state. Because this is a primarily online program, it is strongly recommended that you check with the state certification board if you are not a Michigan resident to make sure that our program meets what your state requires for licensure. So we do have a state-by-state summary available on our website. Again, if you are not a Michigan resident, it is recommended that you take a look at that summary guide to make sure that our program does match up with what your state requires. I mentioned transcripts, so we are looking at your academic history or either your BSN or your MSN, depending on which program you are interested in. We do require a 3.0 GPA in the last 60 credit hours of your BSN to apply. This generally equates to about the last 2 years of your BSN curriculum. If you did an accelerated second degree BSN, generally that's the duration of the program, but we are again looking for that 3.0 minimum to apply. Transcripts should be official copies and they should be sent directly to the Office of Admissions. That address is here, or you can have your school send those via email. They must come directly from the issuing institution, not a copy from you. So again, that's important to note. We do require your BSN degree or your MSN degree come from an accredited college or university. We also are looking for 3 letters of recommendation. These should be professional references. And Dr. Schrader, Dr. Goldstein, if you have anything to add on this, but generally we are looking for recommenders who can speak to your abilities as a nurse, that can highlight your work experiences, that can speak to the skills that you have, what makes you a great candidate for a nurse practitioner program. So we are looking for 3 letters of professional recommendation. Within the application, you will enter in their name and their contact information, and the form is sent to them electronically. It's very easy for both you and for your recommenders. There's no need to mail us anything physically. But we are looking for 3 of those. And the last thing to note here is a statistics course. This is our prerequisite course that we require of all applicants. This course must be taken within the last 5 years. So if you took it 6 years ago, you would need to look to retake that at any time between now and when you begin the program. So you're welcome to apply to the program if you have not yet taken statistics. It just needs to be complete by the time you enroll in the program. This does need to be a 200 level 3 credit course or higher in order to meet the requirement. We are also looking for a 2.0 in that course or higher if you took an undergraduate level statistics course. If you fulfill this requirement with a graduate level statistics course, we are looking for a 3.0 or higher to meet that requirement. So all of these, if you have these required items, then you have a completed application. And again, looking to submit that to us by April 1st for consideration. So that is the program, the application requirements in a nutshell. Of course, my email address is listed here. Dr. Schrader, Dr. Goldstein, if you actually can put your email addresses in the chat box to everybody, it looks like that just came through to us. We'll make a note of those. So of course, we do encourage you to reach out to any of us if you have any questions. We are all very accessible to you. If you have specific questions about your specific situation, certainly feel free to get in contact with any of us. But I do want to open it up for any questions that you do have. Again, certainly feel free to put those into the chat box or into that Q&A box, and we will get those answered.
I do have one thing to add, Molly. So you had talked about the statistics class being required. It is not required for a postgraduate certificate program.
Correct. Yes. Thank you for clarifying.
You just got the 5 courses for the postgraduate certificate, and it does not include statistics.
Great. Thank you, Dr. Goldstein.
Yeah.
And I'd like to add something. We do accept students right out of their bachelor program. So if you, for your letters of recommendation, it can be a faculty member. It could be maybe your preceptor. So don't worry about not having enough letters of recommendation. We can work with you on that. And Molly certainly knows what's appropriate for a letter of recommendation. I just didn't want you to think that you had to be working in a clinical setting as an RN before joining the program.
So what questions can we answer? Any questions about the curriculum? Any questions about any of the courses or clinical experiences, or questions about the application process? Certainly happy to get those answered. And again, feel free to put those in the chat box. And I do see that Jessica included the email addresses. So again, Dr. Goldstein, Dr. Schrader, Jessica's email are all in there. As I mentioned, we're all accessible. We're happy to connect with students, answer any questions that you do have. I can open it up to if any of the three of my co-panelists have anything else to add. We certainly do have time yet to hit on any key points that you feel are important to share with interested applicants.
You know, it's difficult to talk about the role during these sessions. So please reach out and we can set up a time to talk about the role of a primary care nurse practitioner as well as a psych nurse practitioner. You can reach out to Dr. Goldstein. We'd love to talk to you about that because we absolutely love being nurse practitioners.
Right, I do see a question in here. How long does the decision-making process usually take after an application is submitted? That's a great question. I can address this, and certainly if anyone has anything else to add. We do try to release decisions on a relatively quick timeline for you so that you are able to make that decision. Our admissions committee meets once a month to vote on applicants. So depending on when you submit your application within the month that you apply, it could be right away. It could be, a week or so, depending. But again, we do work on a rolling admission basis. So we accept applications throughout the entirety of our application cycle, and we release decisions within a timely manner after receiving a completed application. And I will add too that one thing we didn't touch on, once you submit your application materials, once your application has been reviewed by our faculty, if they feel you are a good candidate and they'd like to connect with you, we schedule interviews with our applicants. So that is a key piece of the application as well. So you'd be invited to have that interview with our faculty members. At this time, we are doing those via Zoom. So once you have the interview, then the candidates that we feel are a good fit for our program, we present those for a vote by our admissions committee. Great question. Other questions that we can answer today? And again, if you have specific questions that you'd rather connect with one of us individually, we welcome that as well. Not seeing any other questions come through. So again, our contact information is in the chat box. I would encourage all of you to take that down. Our website as well is a great source for information, and that is also where you will go to apply. So certainly would love to encourage you all to take a look at our website as well. That is just nursing.msu.edu. That has great information, a lot of the information that was presented today as well, in case you need a refresher on any of the key points. Certainly that's a great source of information as well. All right, well, I will go ahead then and end our session for today. But again, certainly don't hesitate to reach out if there are any additional questions that you have. And we thank you so much for your interest in the nurse practitioner program at Michigan State. We look forward to receiving your applications.
Bye-bye. Go green.
Go white.
Thank you.